If you think you're depressed now, try taking an SSRI antidepressant and get pregnant and possibly end up with a miscarriage or a deformed baby or a baby that's jittery, that cries all the time, that has health complications. And you know what's interesting is that many of the doctors are ordering these SSRI antidepressants for women that are wanting to get pregnant or that are undergoing in vitro fertilization, and these drugs can actually decrease pregnancy rates and increase miscarriages. So
Yeah.
what's going on? Why do they
Well,
order these things?
You have to look at it from the point of view of both parties and what's happening. From the doctor's point of view, the problem is that they don't want to have to deal with the depression on top of everything else that they're dealing with. They want to pass it off and send it to the psychiatrist or a psychologist or somebody who can solve it, because they're experts in helping people get pregnant. So the simple thing to do is just, well, let's try an antidepressant because maybe that will help you, without thinking about the deeper implications of trying to solve the cause of it rather than trying to just solve some of the symptoms.
Well, let's first review what is an SSRI, and maybe we can give some examples of drugs that are SSRIs.
Oh, there are many of them, like Prozac, Paxil, Celexa, Zoloft, Lexapro. There's all those are in a family that are designed to increase levels of serotonin, which is the feel-good neurotransmitter that is in our brains and in many other places in our body.
But aren't there other things that can increase our serotonin that are natural?
There are, but they don't work probably any better. They just don't have as many side effects. They do the same thing. They're trying to elevate levels of serotonin. So things like 5-HTP is often used, or its precursor.
Or how about exercise?
Well, now you're talking about something that makes a lot of sense because it actually works in a way without having any negative side effects. So we know from the studies that were done at Duke University on this that that exercise just an hour 3 times a week will work as well as Prozac that's given in its full dosage.
And recently we were talking about probiotics too. Are those okay for pregnant women?
Those would be okay, and they might help a little bit. But still, I mean, these approaches are no different in theory. They have the same false premise, and that's that you can solve the problem by changing around neurotransmitters. But people are depressed for a reason. And when you're depressed for a reason, the right treatment is to find out what that reason is and see if you can work through it.
Well, you know, I think it's dangerous anyway for pregnant women or women that are thinking about getting pregnant to be taking drugs, because remember years ago when we had all those thalidomide babies because the doctors thought that it was safe for pregnant women to be taking the thalidomide for nausea and anxiety and for sleep. And then they ended up with babies that had stunted limbs or no limbs.
Well, it turned out to be a disaster. That's
Yeah.
actually one of the first drugs that brought to the attention of the FDA that they had to do something to regulate these drugs. And that's why we have a much stronger FDA today than we did 50 years ago. So when we're looking at this whole problem, we've got to make more sense out of what we're doing. We should be thinking about what's the cause of something before we get in there and just try and block the symptoms, particularly when this causes so many problems that are really potentially very serious.
Well, I think that this is powerful information for women to be aware of, because when they're going to their doctor and the doctor prescribes something like this, then they are a little bit more prepared to have this discussion with the doctor and maybe talk about if there are alternatives that they could do besides taking the drugs, because these drugs can also make a woman have preeclampsia or really high blood pressure that could kill her in her pregnancy.
Well, if it got serious enough, that there have been women who have died from that for sure. Well, there was a study that was done and published in October of 2012 in the journal Human Reproduction that talked about all this, and basically their conclusion was there's no evidence to show that these drugs even work in this setting. The data in general psychiatry shows that it doesn't work. When you look at all the studies that have been done, many published and many not published because they've been withheld from publication by the pharmaceutical industry, you look at all those together, there was no benefit above placebo.
So there's no scientific benefit that SSRI antidepressants even work.
That's right. You have to depend on the placebo effect. And of course, what the drug company does is it wants you to throw the placebo effect out. And they're always saying that you can't count on placebo. But you really can, because it doesn't have any side effects. It's safe. and it works just about as well as using the SSRIs.
And this is such a risk. You know, there are other things that can happen too, like your baby can have respiratory distress. They've found that it can increase the rate of autism by 2 times, so twice as much incidence of that the baby can have seizures. And there's like a whole list of things that can happen from taking these. So it's best if you are depressed, to work it out, you know, go to some psychological therapy.
Well, they looked at
maybe,
this. They studied things like cognitive behavioral therapy, which is psychotherapy, and they looked at exercise and yoga and acupuncture and nutrition and relaxation and body work. There are a lot of things that you can do. And their conclusion was the best thing to do is do the cognitive behavioral therapy to find out what's going on. If that doesn't work, if it doesn't work, you can try other things. But that's a good way to start out. So antidepressants are risky in pregnancy. Find a better solution.